This is ANN News Brief.
United Nations agencies, the World Health Organization and UNICEF have said on Wednesday millions of children are at risk because of low levels of childhood immunizations against dangerous diseases such as measles, polio, tetanus, meningitis, whooping cough, and diarrhea. UN says the vaccination levels have dropped alarmingly during the COVID-19 pandemic. Children living in remote rural areas and urban slums are also said to be vulnerable. Nigeria, Democratic Republic of Congo, Ethiopia, Chad, Central African Republic and South Sudan are some of the African countries with high numbers of children who have not been vaccinated. World Health Organization WHO leadership in a joint report with UNICEF said the avoidable suffering and death caused by children missing out on routine immunizations could be far greater than COVID-19 itself. 3/4 of the 82 countries that responded to a survey for the report said they had suffered coronavirus-related disruptions to their immunization programs as of May 2020. At least 30 measles vaccination campaigns have been or at risk of being cancelled, threatening new outbreaks of the contagious viral disease this year and beyond. WHO and UNICEF said nearly 14 million children globally were not immunized against preventable illnesses last year. So far, Angola, Ethiopia, and Burkina Faso are among the few countries that have resumed mass vaccinations following strict guidelines. Rwanda's Interior Ministry has reimposed lockdown in selected areas in the southwest of the country after a rise in coronavirus cases. Authorities ordered from Wednesday movement restrictions for 2 weeks in 2 districts, including a refugee camp which hosts thousands of Congolese. Rwandan government said the measure was taken after assessment of the pandemic in those districts and is being enforced by security forces. The government extended last week a 2-week lockdown in some parts of the capital, Kigali, as cases were said to be rising. Movement has been restricted to essential workers, those going to seek medical care and to shop for food. Rwanda has so far recorded 1,416 coronavirus cases. We'll be right back.
We are on the road every day, canvassing throughout Africa for news you really need. We follow this story everywhere, from every corner of Nigeria to the wide African expanse. We bring you what's making headlines. We connect you with news you can use. ANN, African News Network, in a truly African spirit.
Still in Rwanda, authorities said they are working to increase agricultural productivity to ensure food security. Those in the agricultural sector are asking for faster growing seeds, saying it would help to increase productivity along with more processing plants in order to extend the storage length of produce. The COVID-19 pandemic and the countrywide lockdown that ensued prompted many to stockpile food supplies, fearing shortages, spiking demand, and affecting the agricultural sector. A member of parliament, Professor Omar Munyaneza, says when the entire country was under a total lockdown, it became evident that people needed food security. To ensure such security, the agricultural sector must be supported to develop so that it does not become difficult for all Rwandans to access such food. Rwanda says it's making effort to ensure that the agricultural sector is as productive as possible. The Ministry of Agriculture is preparing early for the 2021 agricultural season, collecting quality planting seeds, more than 4,000 tons for maize when more than 3,000 tons were required, and 326 tons for soya when about 240 were required. That is ANN News Brief at 10. For details on these and other breaking stories, visit our website annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I'm Lucy Adeyemi.